I'm sitting right here.
5, 4,
Oh.
3, 2, 1.
Good morning. This is Carol Dixon. I'm with the Idaho Federation of Families for Children's Mental Health and would like to welcome you to our October parent webinar. Today we are excited to bring back one of our favorite presenters, Dr. Roger Olson, who is from St. Luke's Center for Neurobehavioral Medicine here in Boise, and he continues to have tremendous information for us every time we come. Before we jump into his presentation, I just wanted to let everybody know that next month in November, and we're actually going to do this at the very beginning of November, the first week in November, I believe on the 2nd, we are going to have a webinar that is the power of parent voice. And this is bringing together 3 parents from the Idaho Parents Network who have been very involved in the planning and implementation of the new children's mental health system of care known as YES. We wanted to give them an opportunity to talk about the work that they are doing and what happens when parents come together and really participate with a system or an organization in helping to kind of create changes that are really very family focused and strength based. So put that on your calendar for November 2nd, and we're looking forward to that. And again, Roger, thank you so much for coming back and joining us again.
Yeah, my
I know
pleasure.
that you've got a pretty busy schedule, so thank you for taking a chunk of time.
Well, it's always fun to come.
So this morning, Dr. Olson is presenting on positive psychology and prevention in children's mental health. And it's in our discussion we were having a little bit earlier, it's really interesting because it certainly goes beyond just parenting and is really some great information that parents can incorporate into all aspects of their life. So I know I'm looking forward to hearing it. Thank you much.
You bet. Well, it is a privilege to be here talking to you about mental health issues. I'm a psychologist here in Boise, Idaho at St. Luke's Children's Hospital at the Center for Neurobehavioral Medicine. And so we work with kids and families every day and just really enjoy the privilege of helping encourage strengths in individuals and families and communities. And we're really about prevention and community building and community health. And so today's topic is closely related to that area. And I'd like to give you some ideas on how we can prevent mental health and physical health issues and really help individuals and families thrive. So it's just an honor to be here today. And it's also just an exciting time in the field of psychology. There's a lot of new developments that are going on, and one of the fairly more newer areas in our field is called developmental social neuroscience. And this is a science that looks at the neurobiology of parenting. And it's showing that early childhood experiences literally build a child's brain. And depending on the experiences, whether they're negative or positive, it can have negative or positive impacts on the architecture of the brain. And parenting in particular has long-lasting effects on the brain. And so some of the positive impacts of good environments, whether it's families, children's institutions, schools, some of the positive influences on the brain can be the development of a good stress response system that can last a lifetime, that can help kids bounce back from stressful situations. And that's really the definition of resilience, being able to bounce back from stress. And also kids that experience those more positive environments also build emotion regulation skills, emotional intelligence, problem-solving skills, social competence, and secure attachment in their early relationships with their caregivers. And so looking at some of the factors of resilience, there are lots of different things that kind of contribute to resilience. One is optimism. Kids that have these more emotional regulation skills are better able to have pro-social behaviors and problem-solving skills, goal setting. They often have positive social support and role models, and faith and a sense of meaning often contributes to resilience. However, for kids at risk, when they're exposed to abuse and neglect, violence, mental health illness in their caregivers, then those types of experiences can negatively alter brain architecture. And the stress response that those children often have is characterized by hyper-vigilant defensiveness and also emotional dysregulation. Their emotions are hitting extreme ups and downs, relationship difficulties, insecure attachment with caregivers, and also a lot of times these kids coming from more at-risk backgrounds have risks for cognitive and developmental delays, and also an increased risk of physical health problems like diabetes and heart disease, and also an increased risk of substance abuse and mental health problems. And so I guess the question becomes, so what should we focus on in this, in the field of mental health and counseling and psychology? Should we focus on treating disorders and try to help reduce some of this suffering? Or should we focus more on strengths and helping people thrive and focusing on prevention? And obviously the answer to that question is both. Both is necessary. And so this kind of leads us in our discussion today on positive psychology to this historical division in psychology over the past 60 or 70 years between, do we focus on mental illness and helping cure diseases, or do we focus on thriving and building strengths? And so there's a couple psychologists, Martin Seligman and Mihai Csikszentmihalyi, who are some of the fathers of positive psychology. And in their article in 2000 in the American Psychologist, it was called Positive Psychology and Introduction. They talked about this historical division. Now, Western psychology before World War II was focused on three main goals: treating mental illness, making life more productive and fulfilling, and identifying and nurturing high talent. And so there was a shift from those three goals after World War II to this primary focus on understanding and treating mental illness. Is this focus primarily on reducing deficits. And so that focus on reducing deficits was actually highly beneficial. There was 14 incurable disorders that were researched, and treatments to cure or relieve symptoms were found for these formerly considered incurable disorders. There was a better understanding on how people survive adversity. We made good progress in psychology after World War II in repairing damage within this disease model. But psychology's other goals that they focused on more before World War II, like developing a meaningful life and nurturing talent, those were largely ignored. And so at the turn of the century, in 2000, this field of positive psychology began to emerge and say, hey, we need to get back to some of those earlier goals we had before World War II that focus on nurturing strengths and seeing the best in people. And so Martin Seligman, who probably is the main father of positive psychology, said this. He said, psychology is much larger than curing mental illness or curing diseases. I think it's about bringing out the best in people. It's about positive institutions, and it's about strengths of character. And so we're looking to find this balance between reducing suffering and helping deficits to improve, but also building strengths. And that's largely what positive psychology is doing. It's finding this balance, that both are important. And some of the recent researchers in positive psychology have talked about, just the research evidence. And one individual talked about how much research is focused on the reducing deficits versus building strengths. And he said that there's like 21 research studies on reducing deficits to every one on positive psychology. So we're trying to get that more balanced. Both are important, and we want to get that more balanced. And so in order to do that, and this focus on building strengths, we need to focus on prevention. And prevention is really at the center of the positive psychology approach. The pathology approach does not move psychology closer to a prevention of issues such as depression, anxiety, and addiction. Prevention approaches focus on building competency, not necessarily just correcting weakness. So we need to establish family, school, community, and institutional environments that promote strength, virtue, and core competencies. And so human strengths can really act as buffers against psychological illness. The more we develop psychological strengths, there's a lot of positive benefits. And so we'll talk about some more of that today. But first I want to give some case examples, just some brief case examples. There's a little boy named Tommy. That's his made-up name, not his real name. But let's say he's 6 months old, and he has hip dysplasia. And in hip dysplasia, it ranges from incomplete development of the hip joint to complete hip dislocation. And we see some of that here at St. Luke's at our hospital. And it's easily corrected in most babies when it's identified early. And so here at St. Luke's, we've developed an evidence-based care map for hip conditions with the goal of having better care, improved lives, and reduced costs. And if this condition specifically is identified in the first year, the condition is easy and inexpensive to treat. We want the right test at the right time and get the right referral. And then when Tommy's a little older, Tommy learns to walk. So it's really preventative medicine. And it's just amazing benefits of preventative medicine, because if we miss this condition, this is a physical health condition, if we miss it, treatment can be more complex and costly. And there can be multiple surgeries, by the time the kids are adolescents, costing, hundreds of thousands of dollars. And also, these children, if this issue isn't addressed, they're at higher risk for hip arthritis at age 40 and things like that. So there can be more detrimental effects if we don't catch this and don't prevent it. So we want to teach Tommy how to walk by preventing some of these later problems. So that's kind of a physical health example. And now I want to give you more a mental health example. Let's say this next person's name is Tammy. And Tommy learned to walk. Tammy, we want her to learn to sail. And that's kind of this metaphor for learning how to navigate life in the psychological world and building skills of resilience. We want to help her thrive. However, when Tammy was born, her mother had postpartum depression, which put Tammy at greater risk for emotional dysregulation, insecure attachment, or that close bonding relationship. Parents with depression often have difficulty connecting with their children, have difficulty having empathy and really focusing and tuning into their children because they're depressed and isolating and things like that. And so this really puts Tammy at risk. Also, it puts her at risk for developing mental and physical health problems of her own. Increased risk for cognitive learning and attention difficulties. And so, just like with hip dysplasia, we need evidence-based care maps for identifying and treating early emotional and behavioral problems, not just physical health problems, and also for preventing these emotional and behavioral problems and building character strengths in parents and children so we can help families thrive. And so positive psychology is helping to develop such maps to help children like Tammy navigate through life's oceans and be able to live a healthy, happy life. And so life is like an ocean. It's a place where kids need to learn specific skills that can help prevent future problems. And supportive caregivers, schools, faith communities can help build resilience and self-regulation in kids. Child adversity, however, can often lead to inadequate self-regulation in cognitive, emotional, and the behavioral realms. So caring in responsive homes and community environments can actually buffer children from effects of toxic stress. And so let's talk about some of those programs that can help do this buffering and building resilience for kids. There's a lot of new research out on some of these programs. One is a brief parenting home visit program. Pretty simple program where providers go into the homes and help parents develop skills for parenting and self-regulation, and it actually increases positive parenting behaviors to have that social support come in and encourage parents. It decreases depressive symptoms in parents. And like in the example with Tammy, that will directly impact Tammy's emotional development if the mother and father are less depressed and more healthy. And also, children have fewer emotional and behavioral problems and are at less risk for the rest of their life for developing those types of problems. Treating maternal depression can improve the mental health in children. That's the bottom line. That's the great news. And good parenting is often the most significant factor in boosting resilience in kids. So that's more good news. And there's another study on building strengths in single mothers. And if they can be involved in programs that really build their social support, builds their optimism, these strengths of self-efficacy, like I have an influence over my environment, self-esteem and confidence, then that increases the well-being, the coping skills, and the positive parenting skills that these parents have. And the research has shown that group-based interventions are beneficial due to their cost-effectiveness and emphasis on building meaningful connections with others. So it has some major preventative effects with parents. Also, the research is showing that there's a great new wealth of information on school-based interventions. Children raised in poverty, however, are more likely to enter school with weaker social emotional skills. And so we are, bringing in these programs into schools, and one of them is a social emotional learning program. And the results are really promising with the research on these programs. These kids build better social skills, better behavior, better attitudes, and even better academic progress by 11 percentile points than kids that aren't involved in these social emotional learning programs. There's they're kind of blending mindfulness with this social emotional learning programs, and these mindfulness-based social emotional learning programs target the same skills that predict resilience. They're working on self-awareness in kids, self-management, responsible decision-making, social awareness, and relationship skills. And the children in these programs can experience many amazing benefits, like improved cognitive control, decreased stress, greater empathy and perspective taking, emotional control, optimism, mindfulness, also decreased depression and aggression. And it's also these kids are also rated by peers as being more pro-social and can get along with others better. So just amazing benefits in these programs. So it's extremely promising. So let's look at, we've kind of been talking about positive psychology and some of the key strengths or the key areas in positive psychology. Two of the main factors in positive psychology that I see as having preventative potential in communities and families is strengths of character and mindfulness meditation. And so these two keys can work together to address two goals: to champion what is the best in people, and also use what is best to help people face, manage, and transcend suffering. And so let's look at this first one, the strengths of character. It's a new area in positive psychology, again, kind of developed around 2000 again. And it details the positive aspects of personality. And it was developed in this 3-year cross-cultural project with 55 scientists. And here's what they discovered. They discovered 24 character strengths and 6 universal virtues that are across cultures, that every culture values. And they developed a scientific measurement tool to assess these strengths. And you can take this online survey at viacharacter.org. And it's called the VIA survey. And VIA stands for Values in Action. And there's been over 200 peer-reviewed publications on this idea of character strengths. And character strengths, what they are, they're positive trait-like competencies for thinking, feeling, and behaving in ways that help encourage the best potential in yourself and in others. And one positive psychologist, his name is Tal Ben-Shahar. He was a Harvard professor. He led one of the most popular and well-attended Harvard classes, and it was on positive psychology. He says, what you appreciate, in other words, what you're thankful for, appreciates or grows. And so these strengths of character, we're trying to focus on and appreciate what's good in people. And as we focus on those strengths grow, and kids gain more confidence. And so let's look at some of these universal virtues and values and strengths. The 6 universal virtues that they discovered is wisdom, which is cognitive strengths for acquiring knowledge in applying what you know to life. So that's wisdom. Courage is an emotional strength that helps us face challenges and overcome them. Humanity, which is impersonal strengths that involve tending and befriending. Justice is a civic strength that underlie a healthy community life. Temperance is strengths that protect against excess and transcendence. These are strengths that forge connections with something bigger than ourselves and provide meaning. So those are the universal virtues. And under each universal virtue, there's different strengths that relate to that virtue. Under wisdom, there's creativity, curiosity, judgment, love of learning, perspective. Under courage, there's bravery, perseverance, honesty, zest. Under the virtue of humanity, there's love, kindness, social intelligence. Under justice, there's teamwork, fairness, leadership. Under temperance, there's forgiveness, humility, prudence, self-regulation. And under the virtue of transcendence, there's many strengths such as appreciation of beauty and excellence, gratitude, hope, humor, and spirituality. The more that we can detect these in others, in our family members, in our friends, in our communities, and encourage these, they grow. So and we can take the survey online, and there's a version for children too, and we can encourage the development of these strengths, and it has a positive impact on ourselves and others. And there's some amazing links between some of these strengths. The research is starting to grow in this field, and we're starting to see some links between some different things, such as the character strength of creativity is linked with post-traumatic growth, being able to grow after periods of trauma and suffering, and actually find some new discoveries and a better outlook on life. The strength of curiosity is linked with intimacy. The strength of humility is linked with generosity. The strength of this appreciation for beauty is linked with well-being and self-transcendence. So this field of building character strengths it's really exciting, and it kind of gives us a balancing influence to kind of psychology's approach to reducing deficits and also now building strength. So we're looking at the whole picture now in a more balanced way. So the other key to positive psychology, besides this strengths-based focus, is mindfulness that can really have a positive preventative impact. And we mentioned some of the programs already, but we'll get into some more details of the impact of mindfulness in the research. So let's start off with just talking about, what is mindfulness? It's the non-judgmental attention to and awareness of the present moment. John Kabat-Zinn, who developed the mindfulness-based stress reduction program several decades ago, he says, this is the awareness that emerges through paying attention on purpose in the present moment and non-judgmentally to the unfolding of experience moment by moment. And the mindfulness-based stress reduction programs have been widely researched and just have amazing impacts that we're going to talk about. Daniel Siegel says that mindful awareness may directly shape the activity and growth of the parts of the brain responsible for our relationships, our emotional life, and our physiological response to stress. And so mindfulness is an age-old practice, thousands of years old, that is starting to really grow in popularity over the past few decades. And the amazing benefits that the research is now showing that, humankind has known for millennia, the research is showing that it has significant benefits for pain relief, eating disorders, weight loss, stress reduction, performance anxiety, relationship problems, depression, PTSD, OCD, suicidality, also, some of the newer research is looking at neuropsychological benefits of mindfulness, like increasing working memory, attention, concentration, processing speed, cognitive flexibility. Even for individuals like traumatic brain injury patients and stroke patients, it's showing promise in a lot of areas. It's widely used in schools, clinics, hospitals, in the military. And so it makes sense why this is getting more popular, because the research is catching up with the wisdom of the ages. And so there's a new program called Mindfulness-Based Strengths Practice. And it's really integrating mindfulness with strengths, the two keys of positive psychology. And this is a situation where they work on building mindfulness practices, and they use those to support the unique expression of character strengths in each person that's participating in the program. It's one of the first mindfulness programs to explicitly target positive strengths. It's an 8-week manualized program. Individuals can improve their mindful awareness and character strengths, and this can lead to positive outcomes, such as improvements in overall well-being, a sense of identity, meaning in life, sense of purpose, engagement with life tasks, better stress management, emotional resilience, quality of relationships, sense of accomplishment, and management of problems, better problem-solving skills. And they also have an optional online delivery system where you can take the class online too. So it's great. And so the research strongly suggests that mindfulness can strengthen the brain processes that are important for parenting, and just really give parents an anchor in the midst of the storms, because parenting, like we said earlier, is one of the key influencers in child development and preventing mental and physical health problems. And so mindfulness is a key preventative strategy for helping parents. And so in that light, here's kind of a real-life skills application that mindfulness can help parents and teachers and anybody in the community with. This is called PACE. It's this acronym developed by Daniel Hughes. He's one of the leading attachment therapists in the country. He's a psychologist that works on children with severe attachment disorders, and he is amazing in his ability to connect with children that have trouble connecting with others. And his approach is really is focused on this idea of PACE. And what the acronym is playfulness, acceptance, curiosity, and empathy. It's having this loving and curious stance with kids. And that stance is improved with mindfulness. And let's talk some more about the benefits of mindfulness. There's enhanced physical functioning, like healing and improved immune system responses. More people are more resilient to stress the more they practice mindfulness. There's a sense of physical well-being. There's also possible earned security for parents, and that's kind of attachment-based language for a more strong ability to connect in a healthy way with your children so that they have a secure attachment. And also improved relationships. Parents are better able to perceive nonverbal communication from their children, pick up on those little things, have better empathy, or what Daniel Siegel calls mindsight, which is attunement to the inner world of self and other. And also this idea of improved brain functioning or neuroplasticity. The more mindful we are, the more we are able to sit and calm our mind and body. It actually changes the brain, and that's what we call neuroplasticity, the ability to make new nerve connections and develop new healthy coping skills. So let's look at some more benefits of mindfulness. Mindful parenting with older children, the research is showing that there's decreased parental stress and reactivity, improved parental self-regulation, we have more self-control as parents, decreased child behavior problems, even when the treatment is not focused on the child. For example, this one study on mindfulness was working with parents on just building mindfulness skills, but it wasn't a parenting program. It was just focused on teaching mindfulness skills to the parents. They didn't talk about how to help Johnny behave better. But actually, Johnny learned to behave better because the parents were more self-regulated. They were more under control in hot situations with their children and more calm and empathetic and loving and nurturing. So naturally, their parents, the children of those parents had better behavior. Mindfulness expands the key brain structures for parenting that link the head and the heart, or the thinking brain and the prefrontal cortex to the limbic system, which is more the feeling brain. It helps connect those two parts of the brain to help us be able to regulate ourselves in tough situations. There's a program called Mindfulness-Based Cognitive Therapy for pregnant women with anxiety. And the research on this area showed there's a significant reduction in anxiety, worry, and depression in these pregnant women. They also had significant increase in self-compassion and mindfulness. The research is also showing benefits for childbirth. There's a program called Mindfulness-Based Childbirth and Parenting, and this led to increased confidence and decreased fear of childbirth for people that participated in this program. There's also a decrease in pregnancy anxiety and depression, reduced perinatal stress and anxiety. Reduced maternal stress has long-term effects on the physical health of the child due to changes in the intrauterine environment that impacts prenatal programming. So if the parent is less stressful during pregnancy, that provides a more nurturing intrauterine environment, which will help the child in their later development. There's increased in positive emotions for individuals in this program, improvement in the non-reactivity factor of mindfulness. We're able to respond and not react. There's increased acceptance of internal experience and external situations with a non-judgmental attitude. It taps into this deep inner resource for working with pain, and we know that childhood is an extremely painful situation, but it helps mothers deal better with that pain. It also improves couple communication, connection, and cooperation. Partners show increased support and attention to mother and child, and it provides stress-reducing skills for greater joy and well-being. And there's no better time to start than, as far as parenting, is during the pregnancy and in that perinatal period, right around birth. And so let's look at the 5 factors of mindfulness that likely are connected to all these amazing benefits. There's this factor of non-reactivity, this factor of non-judgmental observing, acting with awareness versus acting on autopilot, and describing with words, and again, just this non-judgmental approach. And so let's talk some more about the benefits of starting early. So this perinatal period may be the best time to learn mindfulness because of heightened motivation and attention. Parents are really motivated to help this child get a good start. And the research suggests that people who receive mindfulness training during the perinatal period continue to use these skills in their parenting. And so, and as they do that, they're more regulated, and that helps their children develop their own powers of self-regulation. And that's the ultimate goal here. And William Miniger said, it's difficult to give children a sense of security unless you have it yourself. If you have it, they catch it from you. So we want to help parents have these strengths-based skills so that they can pass these on to their children. And that will have amazing preventative impacts on the families and communities. And so let's look some more at that parent-child bond. Attachment in these early relationships is fostered by a mindful, empathetic stance toward the parent towards themselves and towards their child. And the best predictor of a child's attachment to a parent is the parent's own self-understanding. And the quality of attunement depends on the parent's awareness of their own internal experience, as well as the body-based emotions and needs of the child. So, as this parent attends to and communicates the mental states of the child in a consistent, balanced, and flexible manner, the child has a better chance of developing secure attachment and later psychological resilience. And so this idea of parental responsiveness, how do we help parents be responsive and tuned in? It's almost like this Wi-Fi connection between the brain of the parent and the brain of the child. That's how Daniel Hughes talks about that relationship in his book, Brain-Based Parenting. It's this Wi-Fi connection. How do we tune in? Well, so this responsiveness to the infant, we start early. It's the key to developing a secure attachment. We're tuned into their affect, which is their body-based emotions. Because obviously an infant can't communicate with the words yet, so we have to tune into their nonverbal cues and their body language. And as parents do this, they tune into these emotions. They can respond with more empathy and be more sensitive, and they're able to what we call feel and deal, which means staying cool in hot situations, being able to experience your feeling, but respond in a loving, nurturing way, not just reacting. So it's kind of like taking a step back, taking a breath, and then responding. And that can have amazing impacts on the attachment. And so the result of that is the child's emotions are regulated. They're able to return to a state of felt security and playfulness. The child learns to expect that their needs will be reasonably met, not perfectly, but reasonably met, and that they can handle challenging situations. So as this cycle of soothing the daily storms is repeated, the brain is protected from chronic stress and is able to make more positive nerve connections that enables the child to have a stronger self-soothing system. And so it's a way to help prevent these problems, kind of like we talked about with Tammy. We want, even though her mom has postpartum depression, we want to go into that family and help the mother build some skills that will help her connect to her daughter, and then help her daughter develop some resilience and being able to deal with stress, and also have more emotional intelligence. And not only in the home setting can some of these prevention strategies be utilized, but also in the school settings. Research is showing that students of mindful teachers, so these are teachers with their own mindfulness practice where they daily practice kind of calming their mind and body down. So students of these types of teachers come to experience the academic, social, and emotional benefits of mindfulness, even when the teacher does not explicitly teach these skills in the class. So basically, a mindful teacher can pass on these skills without explicit instruction. And here's the interesting part. Students of teachers who teach mindfulness explicitly, but they don't have their own practice of mindfulness, these students tend to get worse on most measures. So if the teacher isn't mindful in her own life, even if she tries to teach these skills to kids, the kids don't catch it. So it's back to that metaphor we said earlier. If you have this sense of security, your kids will catch it. And so that's pretty interesting as far as, helping teachers build these skills just in their, private lives so that they can pass these on to kids, which will have amazing preventative effects again. And so let's look at some of these effects. What are some of these effects of the secure attachment, whether it's, a positive connection with a teacher or more foundational connections at home. These children have the 4 S's, we call them. And this is, again, from Siegel's work. Being seen, safe, feeling safe, feeling soothed, and feeling secure. If the child has those 4 S's, it kind of counteracts the 4 F's of the fight or flight response. The fight, flight, freeze, or faint. And so again, parents and teachers with mindfulness, kind of a more non-judgmental awareness and a nurturing but structured environment can help kids experience these 4 S's. And so the secure attachment of a parent can impact, like we mentioned briefly before, this idea of earned security. Even if parents didn't have a secure attachment with their parents, They can learn how to have a secure attachment currently with themselves and with others by doing some self-understanding and self-searching and some mindfulness and strengths-based training. And mindfulness training may cultivate a key aspect of this earned security, which is metacognitive processing, which is a big fancy word, which means the ability to reflect on one's own thinking as it happens. And it's basically this ability to think about thinking. It's called metacognition. Mindfulness builds that strength, which directly impacts our ability to connect with others and connect with ourselves. So with this increased self-awareness and emotion regulation skills, parents are less likely to pass on unhealthy attachment patterns to their children, and which will help the physical and psychological health outcomes for kids in the long run. So it's kind of like mindfulness is like a lullaby that wraps you and your child in love and security. And the benefits of increased emotion regulation for parent and child, as well as more compassion and empathy, can be crucial when attachment security is at risk. Like we talked about, with postpartum depression, or after a difficult labor, or when your child is stressed or underweight as a newborn, or if there's just a poor temperamental fit between parent and infant. We need a safe, nurturing environment to help the parent and the child through some of those hardships, and mindfulness can be that. And so as we're helping Tammy navigate life's storms, this capacity of the mother to observe her own difficult experiences and soothe her own frustration, confusion, or disappointment may mean the difference between navigating the challenging times or distancing herself from her child unconsciously. And so, again, looking at prevention to help Tammy learn how to sail, how to navigate life's storms on this ocean of emotion that we call life. And to do that, we want to look at self-compassion. It's fundamental to mindfulness. It's regarding oneself with kindness and understanding rather than with harshness when feelings of pain, shame, or failure come up, which are kind of common in postpartum depression. Being aware of painful thoughts, feelings, or sensations without having to over-identify or fuse with them. It's being able to observe and respond and not necessarily have to react. And so let's look at some more real-life skills where the rubber meets the road in parenting that will help some of these preventative things to happen. Daniel Siegel, in his book, The Mindful Brain, talks about approaching every here and now moment with COAL, C-O-A-L. And this is curiosity, openness, acceptance, and love. It's kind of like Daniel Hughes' PACE. And again, the more mindful we are, the more we're able to approach our children in life situations with this curiosity, openness, acceptance, and love. And so the key is that we're all building, is this idea of emotion regulation. The happiest parents and children are those who are most well-regulated. And we've been talking about all the benefits of this mindfulness-based approach that can help kids and infants be more well-regulated. And the costs of not doing this preventative work, the costs are huge. Not only are there toxic psychological effects of chronic patterns of negative expressed emotion and emotional dysregulation, but there are detrimental impacts on biological systems as well, like high blood pressure, inflammation, hormone levels, which can lead to many physical health problems. So the situation is, it's really dire. We have so much potential and so many strengths, and there's so many things that we can address in reducing deficits and building strengths with some of these approaches. And we mentioned Daniel Siegel, his idea of mind sight. He calls it this idea of being open and non-defensive in focusing on the inner lives of self and others. And at St. Luke's, we're building more and more our mindfulness programs for early childbirth and parenting, and also for later programs, for children in elementary school. And even, like my parenting classes, they're open to parents of any ages, even parents before they have kids, when they're pregnant, up to grandparents. And we really want to reach out and help the community build some of these skills. And three of the main skills that I like to work on in some of my parenting classes, I call them the 3 keys of mindful parenting. The first one is the heart of parenting. And the more mindful we are, the more we're able to value the relationship with the child over trying to change their behavior. When we're trying to change the behavior and focus on controlling things that are out of control, the behavior usually gets worse. So that's the heart of parenting. The mind of parenting is this idea of balancing the nurturing and the love also with the structure. And really this is a courageous commitment to live our values. We can control ourselves and build some of these skills. The more we do that, our kids will naturally learn these skills. We don't have to be so worried about forcing them to change, because when we do that, they don't change or their behavior gets worse. But as we focus on living our values and being loving, but also setting a nurturing and structuring environment, they're going to grow. And then the soul of parenting, I call it this obstacle as opportunity perspective. And what that really means is that challenges, our kids' emotions, maybe when they're running hot, all those different things that happen in our parenting life are opportunities for connection with our child. But we have to step back and have a mindful approach and not just react and try to lecture or, give judgment or anger. There's a hidden opportunity to connect with our child at those moments. However, we need to acknowledge our own strengths and build our own mindfulness skills to be able to see those hidden opportunities as we are, again, navigating on this ocean of emotion that's really challenging, and trying to teach our kids how to navigate on this storm-filled life. And so here's kind of the metaphor. We're sailing on the ocean, and we see the obstacle, whatever it may be, like we mentioned, a behavior or an emotion in our child that really, hits us wrong. Our tendency is to react, be on autopilot, and not really be aware of the here and now and respond in a way that's going to help our kid build skills for a lifetime and to be able to be a better parent to your grandchildren. So let's give them those skills, but we have to have the skills first. Here's what we do. Here's a mindful, kind of where the rubber meets the road type of thing. Stop, take a breath, open and observe, open to the situation. Again, be curious, non-judgmental, and then proceed. So you can take a breath at any time. Even if it's 1 second, take a breath before you respond. And live your values. How do you want to respond? Live consistent with your values. Once we do that, once we take a step back, usually we can see a small opening begin to appear. A way to connect with our child, maybe after they calm down, maybe after we calm down. And as we get closer to the situation, we have a better opportunity to really see the real issue and come in with understanding and nurturing. And then after things calm down, once we've communicated that understanding, then we go on to the problem solving together and find some win-win solutions. And so this type of perspective is empowered by mindfulness. When we're mindful, we are better able to manage stress and be present and responsive with our children rather than absent-minded and reactive. And so parenting and teaching and just life in general can be stressful. And so the key to stress management, according to Brian Seward, he's one of the key leaders in the field of stress management. He wrote a book called Stand Like Mountain, Flow Like Water, a great book on stress management. I believe this, with Brian, that the Serenity Prayer is key to stress management because it reflects these 3 keys of mindful parenting. The first step is serenity to accept the things that we cannot change. Many of you are probably familiar with this, the Serenity Prayer. Number 2, it's the courage to change the things I can. And 3, it's the wisdom to know the difference. So we're really accepting our children in a loving environment. We're not trying to change them, but we're living our values and seeing opportunities to connect with them, having that wisdom to step back and then proceed and connect. The Chinese version of the Serenity Prayer is really eloquent. It's called Stand Like Mountain, Flow Like Water, which is the title of that book I just mentioned. Stand like mountain means to have the courage to change what we can change. Flow like water means to accept what we can't change. And so that's really a good picture of letting go of what we can't change and focusing on what we can, building our own strengths, and naturally that will build the strengths of our children and prevent so many issues. So we can improve our capacity for compassion for ourselves and others in two ways. Interpersonally, by practicing being openly engaged and empathetic with another person. We've talked about that in the parenting relationship, but it can apply to any relationship, in couples, coworkers, etc. And also intrapersonally, through practicing mindfulness in ways that enhance our ability to let go of this judgmental process and stay more present in the moment with ourselves. And then, as we do that intra work inside, that mindfulness skills, that naturally builds empathy with others, because you're basically being empathetic and understanding to ourselves, and that flows to empathy to others, which builds strengths in others and teaches them mindfulness skills just by witnessing us. And so, in closing here, I want to encourage all of you out there to be an advocate for your children, to champion what is best in them, empower them to face and transcend challenges. And the more mindful that we are, the more we can advocate for kids, the more we can build their strengths, the more we can prevent not only psychological and mental health problems, but we can prevent physiological health problems down the road for them. It gives them the tools to navigate life. And so I encourage you to do this in any environment where you're working with children, in the schools, in your homes, in the communities, and come along with us to build healthy communities and families. So thanks so much for your time, and appreciate the opportunity.
So, Roger, I think 5 years or so ago, I read John Kabat-Zinn's "Wherever You Go, There You Are." Mm-hmm. And my impression is he's one of the ones that brought mindfulness to kind of the United States and our Western culture. And it was really a transformative book in terms of understanding those concepts and starting to practice some of those in my own life. So it's amazing, and it's a great book. And I'm sure there are many mindfulness books out there, but that one for me was really pivotal. So tell me your thoughts on, I wish I'd read it 25 years ago, but it is what it is. But so with older kids that I have that actually have left the house, but I was thinking more in regards to teenage years. A parent who has practiced this and has taught their children just by the way they live it, how does it help counterbalance what I see a lot of our kids dealing with, the pressure, the stress, the social media, and all those things that I feel like they are bombarded with? Because we do in our adolescent population, starting at and even before adolescence, the anxiety, they're off the charts in terms of kind of record levels of anxiety within our youth.
Right. That's a great question. And we can't control a lot of that environment that they're involved in. But what we can control is what type of environment do you provide for them when they come home, or when they're in your car and you're driving them somewhere? What are you trying to provide for them? And it may be just in little brief times, because a lot of times with teenagers you don't see them much. But even in those brief times, they can feel safe. They can know that you're going to have your values, but you're not going to be judgmental, and you're not going to be overly aggressive in telling them what to do.
Right.
As you have a more mindful approach, they will see that, and they will tend to open up more with you. Mm-hmm. And again, naturally learn some of those skills just by example.
Right.
And you can have an amazing impact on them, even if it's not so much explicitly teaching them those things. Just like the study on the teacher, the kids learn those skills when their parent when the teacher shows those skills.
So hopefully develop some resiliency with them in terms of just not feeling so overwhelmed.
Absolutely. Yeah, giving them a sense of confidence that, hey, there will be stress in life, but I have what it takes to face those challenges, because my parent even if we don't always agree, they give me the vote of confidence that they believe in me, even when I don't believe in myself. They believe in me and they believe I have what it takes. But a lot of times as a parent, it takes seeing those unique strengths in that child before they see it in themselves. And your vision of those strengths and how they may develop and what these children are going to be like when they're 25, holding that picture in your mind is a powerful way to help them believe in themselves. But we have to have a very mindful approach to be able to see past some of the behavior and the attitudes,
Right.
and to be able to see that vision that they have some amazing strengths and they're becoming a great person. As we approach them that way and not as a little kid, and lecture them and tell them what to do, they will begin to believe that picture that you have of them. It's pretty powerful.
Yeah, amazingly so. And my impression is the more that you practice it, the more you become it.
Yes.
So it does take time and being very intentional. And you're not gonna do it perfectly.
Right.
It's a hard place to always stay in, but the more that you do it, the more you will find yourself in that space.
Absolutely, and that kind of reminds me of John Gottman's approach to repair. He's a researcher and a therapist at the University of Washington that does a lot of marriage counseling, also a lot of parenting work and research. He talks about this idea of a quick repair. If you make a mistake as a parent or in a marriage relationship or whatever, quickly acknowledge your mistake and say, hey, I shouldn't have yelled, or I lost my temper there. I'm sorry. Hey, will you forgive me? And repair that with that child. And that gives the child an example of, oh, that's what I'm supposed to do when I make a mistake. Nobody's perfect. It helps them see that, hey, you're human and that you're willing to admit your mistakes and you're willing to value the relationship enough to repair that. And that's another great way to be an example to them.
Yeah. Great concept. And with our busy society that I feel like that we have, and again, we're bombarded from all sides, it's a perfect time for this type of practice to be able to learn and share with your family. And so tell us a little bit, because I know you have some parenting classes going on.
Yes.
So for those that are kind of in the Treasure Valley, that you will be teaching more kind of on this concept. Can you share some of that information?
Yes, we have some mindful parenting classes. We have one going on now at St. Luke's. And then also we have another one coming up in the spring. And we also have a lot of birth and parenting mindfulness classes that are done on a regular basis for people in the hospital getting ready.
Okay. Well, with that, thank you very much. Again, we always appreciate.
If you could cover the classes that are available for parents with young children. That was a question.
Oh, yes. Yes, and we just mentioned there was a question from the audience that about the parenting classes. Just call St. Luke's at 208-381-2000, and you can get some access to some of the parenting groups. I'm teaching one right now that's finishing up next week, but also we'll start another one in the spring. And that'll probably be February, March time. But also there's ongoing early childhood mindfulness classes in the birth and parenting program.
Okay. And the more demand, the more classes will be available.
Absolutely.
So definitely, if you're interested, call St. Luke's. The classes may not be starting right now in the spring, but the more St. Luke's hears that their parents are interested, they will build more classes to meet the need.
Yeah, absolutely.
So for those that are interested in the PowerPoint presentation, it is on the Idaho Federation's website, which is idahofederation.org, and it's in a PowerPoint format under the webinars tab, I believe, so you can access that there. It's a YouTube video also. We're live streaming, so that if you want to share that with friends and family, you can certainly send them to that, or send them to the page, and the link will be there on the YouTube page. So thank you for joining us this morning. Hope to see you next month. And again, Roger, would love to see you again.
Thank you.